Hello and welcome to today's webinar. My name is Carolyn Hughes and I'm one of the assessment consultants at Pearson Clinical Assessment. So today I'll be giving you an overview of our mental health assessments and resources. So that you can be there for those that need your support, we have a range of assessments that can help to screen or diagnose mental health problems. This includes assessments that can be used digitally and during your telepractice sessions, as well as paper kits. So today's webinar will last approximately an hour with time for questions. And because of the nature of a webinar, we will wait to have questions at the end. So please feel free to write these in the chat box throughout the session. If your questions do not get read out or answered, we will get back to you after the webinar. So the agenda of today's webinar will begin with information about Pearson's mental health support resources. Then I will provide an overview of our standardised mental health assessments, including behaviour, ADHD and social emotional skills, depression, anxiety, self-image and self-esteem and other areas, and then autism assessments as well. And then finally, I'll give a brief overview of Q Global, our online administration and scoring platform. So at Pearson, we have been working on our mental health support resources. So developing a healthy mind is just as important for our overall health as our physical condition, with stress, anxiety and our internal feelings being major factors that can change how we perceive ourselves and the world around us. We've created a range of useful mental health support resources that are suitable for practitioners, teachers and students of all ages. So we've created a mental health assessment brochure, and our mental health assessments are created by world-renowned experts in psychology to support qualified health and education professionals in identifying mental health issues and concerns in children, adolescents and adults. We've created an easy-to-use guide that splits our mental health assessments into various topics and areas. We have a support for schools mental health toolkit. We know how important it is to encourage a culture of positive well-being and mental health in today's environment. This useful mental health support in schools toolkit has been created in collaboration with psychologists and SENCOs to provide helpful tips and advice on how to aid your students in the classroom, as well as when to seek expert support. We have a series called Succeeding in SEND and a focus on supporting students during difficult times. In this exclusive series, we present insightful conversations between SEND students and experts. We launched with a focus on dyslexia with Helen Bowden, CEO of the British Dyslexia Association, and this was followed by a focus on autism with Dr. Callum Harley, and that was in November. You can also join Melanie Atkins and Mary Long for a discussion on how to support children with anxiety, behaviour and mental health issues during difficult times. And then finally, we've also created a wellbeing zone. Our new wellbeing zone provides a space dedicated to support all ages. You'll be able to find resources from advice on coping with anxiety to fun activities to help support mental health and well-being suitable for health professionals, teachers and young people. It even includes mindfulness for unsettling times, which is an introductory practice for teachers and parents that can be used with children and students, created by our mental health and wellbeing senior product manager, Ashley Lodge. And I've just added a link on this slide for you so you know where to find it. You just need to go onto the Pearson UK website. Okay, so just before I begin talking about the various products, I wanted to mention our qualification codes at Pearson Clinical. You'll notice that there is a code on each assessment that I talk about today, a qualification code. And all Pearson Clinical Assessments products in the UK are assigned to a qualification level of either CL1, CL2, CL2R or CL3. CL1 being the highest qualification level. In order to establish your tests, which tests are available to you, simply compare your training qualifications with the qualification code. I'll just go through each one briefly now, but if you do have any queries, just visit our website or feel free to ask me any questions. So the qualification for level 3 are for those assessments that do not require the individual to have advanced training in assessments and interpretation. So this would include qualified teachers. The qualification level CL2R is for tests that require a qualified teaching status and a further postgraduate qualification in SEN. For example, a postgraduate diploma or a master's. And this qualification would need to be in SEN, SPLD or a relevant field at level 7. Then we have a CL2 qualification code. So this is for individuals who are certified by a professional organisation recognised by Pearson Assessment. This assessment code would encompass all psychologists, speech or occupational therapists, mental health professionals and health practitioners. And then finally, the level CL1 is it requires a higher level of expertise in test interpretation and can be purchased by an individual who is registered with the HCPC as a practitioner psychologist or as a chartered psychologist with the BPS. So it includes those who are registered with the HCPC as a practicing psychologist, as clinical psychologist, forensic psychologist, counselling psychologist or educational psychologist. Okay, so now we can begin with the BASC-3. The BASC-3 is a multi-method, multi-dimensional system used to evaluate the behaviour and self-perceptions of children and young adults aged 2 to 25 years. The core elements of the BASC-3 retain those of the original BASC and the improvements implemented from the second edition. All of the BASC-3 components are tailored to setting and informant and have relevance to diagnosis, evaluation and treatment. The BASC-3 is sensitive to both obvious and subtle behavioural and emotional disorders as expressed in school and clinical settings, and to academic and family demands on a child and adolescent development. It provides a sophisticated approach to the evaluation of behavioural and emotional disorders among children and adolescents. So the forms include the teacher rating scales, the parent rating scales, the self-report of personality, the structured developmental history, and together they can help you to understand the behaviours and emotions of children and adolescents. You can see on your screen the age ranges for each form, and it provides the most comprehensive set of rating scales which measure areas important for both IDEA and the DSM-5 classifications. The BASC-3 applies a triangulation method for gathering the information by analysing the child's behaviour from 3 perspectives: from self, from the teacher and the parent or caregiver. This allows you to get a more complete and balanced picture, and combined, these tools provide one of the most comprehensive systems currently available. So the teacher rating scales can be used to measure adaptive and problem behaviours in preschool and a school setting. You can use the parent rating scales to measure both adaptive and problem behaviours in the community and home setting. And the self-report of personality provides an insight into the child's or adolescent's thoughts and feelings. And then you have clinical scales, which measure the maladaptive behaviour and consist of items written for each corresponding scale. There are adaptive scales, which measure constructs that are often considered behavioural strengths. The composite scaled scores are helpful for summarising performance and for drawing broad conclusions regarding different types of adaptive and maladaptive behaviour. And the composite scores represent behaviour dimensions that are distinct but not independent. And the scores that are available from the BASC-3 are T-scores and percentiles. This assessment is available on our online platform Q Global, and this actually allows you to send a secure link to the rater for them to complete. The results will then be sent back to you via the platform for you to generate a report. You can also generate an intervention recommendations if you require. There are also a few other assessments in the BASC family of assessments. I won't be talking about them today, but if you want to have a look on our website, you'll be able to find the BESS, which is the Behavioural and Emotional Screening System. This is a brief universal screening system for measuring behavioural and emotional strengths and weaknesses in children and adolescents. There is the BASC-3 intervention guide, which presents details on 60+ interventions, including both theoretical, practical information relevant for each intervention. And then there's also a parent relationship questionnaire, which captures a parent's perspective on the parent-child relationship. So next we have the Brown EFA. This is an update of the Brown ADD scales. The Brown Executive Function Attention Scales helps screen and assess a wider range of impairments and executive functioning. The Brown EFA scales measure the DSM-5 symptoms for ADHD along with less apparent impairments of executive functioning. It is a set of rating scales designed to evaluate executive functions related to ADHD in individuals aged 3 and older. The Brown EFA scales consist of parent, teacher and self-report forms over 4 age levels. They can be administered, over three age levels. They can be administered using Q Global or via a paper questionnaire form. If using a paper form, you can then either choose to hand score or score via Q Global. The assessment can take between 10 to 15 minutes to administer, and it has a CL2R qualification code. The items on the Brown EFA scales are grouped into 6 clusters, each representing an underlying aspect of the author's model of executive function and impairment as it relates to ADHD. So the first is activation. The activation cluster addresses difficulties the individual may have organising tasks and materials, estimating time, prioritising tasks and getting started on work-like tasks. The second is focus. These include the problems individuals may have in sustaining attention and focus for work-like tasks or in shifting attention when needed from one activity to another. The third is effort. This looks at problems individuals may have in staying alert and sustaining sufficient work-related tasks. It also addresses difficulties with processing information, completing tasks and maintaining performance consistency. The next is emotion. This looks at difficulties the individuals may have with regulating emotional reactions to the extent that they may take over too much of what the individuals are thinking or what they are doing. Then we have memory. This looks at problems the individual may have with forgetfulness, specifically in daily routines, and the recall of learnt material. And then finally, the last cluster is action. This looks at problems individuals may have recognising appropriate behaviour and self-regulating their actions. The normative scores that are reported are T-scores and percentiles. Next, we have the Social Skills Improvement System, the SSIS, and it's the Social Emotional Learning Edition. This offers a brief screening and progress monitoring form that can be completed by teachers, as well as more comprehensive teacher, parent and student forms, all of which can be used to assess a child or adolescents who are aged between 3 and 18 years, social emotional skills. The forms include a screening progress monitoring scale, and this can be used with students from ages 3 to 18 years as a classroom-based screening tool to assess social, emotional and academic functioning of students. And it can also be used as a monitoring tool to evaluate changes in social, emotional and academic functioning several times with an intervention. There is a teacher form, and this is completed by any teacher or someone with a similar role who has a good understanding of the child's functioning. There's a parent form, which is to be completed by a parent or caregiver who has an opportunity to observe and interact with the child several times a week in the month prior to rating. There is a student's form, and this form obtains the student's self-rating, which can be really important because they can add information about the perceptions and beliefs that they are not readily observed by others. Each can be completed digitally using Q Global to administer online or remotely, and then scoring and reporting. The social emotional skills represent 5 competencies: self-awareness, self-management, social awareness, relationship skills, and responsible decision making. Scores are provided for each of the 5 SEL competencies. In addition, scores are provided for the SEL composite scale, representing an overall index of social emotional functioning, as well as for the core skills scales. A score that represents functioning on 10 core social emotional skills, and raw scores are provided along with standard scores with a mean of 100 and a standard deviation of 15. As well as percentile ranks. Higher scores indicate higher, more desirable levels of functioning. The SSIS SEL also has a class-wide intervention programme. This provides 23 skill units covering these 5 social emotional competencies, making a highly effective instructional approach with all digital materials, including PowerPoints and videos. And this is to help maximise engagement. Next, we have the self-image profiles. These are brief self-report measures of both self-image and self-esteem with UK norms. The self-image profile, or the SIP, has a child and adolescent version and an SIP for adults. For the SIP child and adolescent, there are 2 forms. The child's form is from ages 7 to 11 years, and the adolescence is from 12 to 16 years. Both have an identical format and scoring procedures, but have different item content appropriate for their age. Both consist of 25 familiar self descriptions, 12 of a positive nature, for example, happy, friendly, and 12 with a negative slant of, for example, lazy or moody, and 1 item on sense of difference. All statements are generated by the participant, and the participant indicates how they think they are and how they would like to be. And they'll be using a 0 to 6 scale, 0 being not at all and 6 being very much. Aspects of self-information can be obtained in domains including the following. So for the children's version, it looks at behaviour, social, emotional, outgoing, academic, resourceful, and appearance. And for the adolescent form, it looks at expressive, caring, outgoing, academic, emotional, hesitant, feel different, inactive, unease, and resourceful. And then if you're looking at the self-image profile for adults, this is for ages 17 years to 65 years. And this provides an extension to the child and adolescent profiles. Again, it has UK norms, and it consists of 32 items rated by the respondent in terms of how they think, what they think of themselves and how they would like to be. It provides a visual display of self-image and also provides a measure of self-esteem, which can be calculated by the discrepancy between the ratings of who I am and who I would like to be. Okay, so next we have the Beck range of assessments. So the Beck range is mainly for people aged 17 and above. However, the depression inventory can be used from 13 years, and I'll go through each one of these that you see on your screen, that you can see on your screen now. The Beck Depression Inventory 2 is the world's most widely used instrument detecting depression. This edition now has an age range extended down to 13 years, providing clinicians with a sensitive tool for assessing younger clients. It still takes just 5 minutes to complete and is more clinically sensitive than ever. It consists of 21 items to assess the intensity of depression in clinical and normal populations. Each item is a list of 4 statements arranged in increasing severity about a particular symptom of depression. Then there is the Beck Depression Inventory Fast Screen. It's a 7-item self-report, case finding information instrument that screens for depression in adolescents and adults. It consists of items extracted from the Beck Depression Inventory 2 and measures the severity of depression that corresponds to the psychological non-somatic criteria for diagnosing major depressive disorders as listed in the DSM-4. The Beck Depression Inventory Fast Screen was constructed to reduce the number of false positives for depression in patients with known biological, medical or alcohol substance abuse problems. It should not, however, be considered as a substitute for the Beck Depression Inventory 2. This one is to be administered by paper only. The Beck Anxiety Inventory measures the severity of anxiety in adults and adolescents aged 17 years and older, giving professionals a firm basis upon which to make confident diagnostic decisions. It evaluates both physiological and cognitive symptoms of anxiety, and item overlap with other self-report depression inventories is minimised. This also consists of 21 items. Each item is descriptive of the symptom of anxiety and is rated on a scale of 0 to 3. The Beck Anxiety Inventory has been found to discriminate well between anxious and non-anxious diagnostic groups, as well as a result. Is useful for screening is used for a screening measure of anxiety in a variety of clinical populations. There is also the Beck scale for suicide ideation, the BSS. This was developed for use with patients of 17 years and older and provides a good starting point for a clinician's more detailed examination of a patient's suicidal intent, as well as monitoring suicide ideation of patients who are known to be at risk of suicide. The manual provides data on both inpatients and outpatients, and the items correlate highly with items that relate to suicides on other Beck scales. It's made up of 21 items and can be completed in 5 to 10 minutes. 2 of the questions on the scale are designed to function as an internal screening component. This component saves time and reduces the intrusiveness of the questionnaire for patients who are non-suicidal. Then we have the Beck Helplessness Scale, the BHS. This helps you to measure 3 major aspects of hopelessness for people aged 17 years and older: feelings about the future, loss of motivation, and expectations. It is designed to measure an individual's attitudes about their long-term future and consists of 20 true/false items, with patients either endorsing a pessimistic statement or denying an optimistic statement. It acts as a powerful predictor of suicide intent. All of these forms and all of these assessments, apart from the Beck Depression Inventory Fast Screen, can be administered and scored via Pearson's online scoring platform, Q Global, and you have the option for on-screen administration or remote administration. Next, still in the Beck group of assessments, we have the Beck Youth Inventory, and it's on its 2nd edition. This one allows you to assess children and adolescents aged 7 to 18 years with confidence and help to plan effective interventions. There are 5 self-report inventories within the Beck Youth Inventory, which can be used together or separately depending on what you would like to assess. The Beck Youth Inventory can also be administered and scored via Pearson's online scoring platform, Q Global. Each inventory contains 20 statements. They rate how frequently the statement has been true for them. The inventories included are the Beck Depression Inventory, includes items that reflects the respondent's negative thoughts about himself or herself, his or her life and future, feelings of sadness and physiological indications of depression. For example, I feel like no one loves me and I feel empty inside. The Beck Anxiety Inventory includes items reflecting fears, for example, about school, getting hurt and their health, worrying and physiological symptoms associated with anxiety. For example, I'm afraid that I might make mistakes or my hands shake. There is a Beck Anger Inventory, which includes items or perceptions of mistreatment, negative thoughts about others, feelings of anger, and physiological arousal. For example, when I get mad, I stay mad. When I think of my life, it's unfair. And then finally, oh no, 2 more. You got the Beck Disruptive Behaviour Inventory, which includes items related to behaviours and attitudes associated with conduct disorder and defiant behaviour. For example, I like to hurt animals. I like it when people are scared of me. And then we have the Beck Self-Concept Inventory. This includes items that explore self-perceptions such as competence and positive self-worth. Examples of this could be I feel proud of the things I do, or I'm happy to be me. This assessment can be used together with the Resiliency Scale, which I'll talk about next, in order to get a comprehensive view of a person's health and well-being. So the Resiliency Scales are for children and adolescents, and it enables group or individual profiling of personal strengths and vulnerabilities of children aged 9 to 18 years. The scales can be used separately, together, or in conjunction with a symptom-based measure to obtain a balanced view of the child or adolescent. It is child and adolescent friendly, allowing the children to focus on strengths as well as symptoms and vulnerabilities. It is treatment focused, enabling you to quickly screen for personal strengths. and it can help generate and prioritise intervention strategies and systematically benchmark and monitor responses to interventions in terms of strength enhancement as well as symptom reduction. So there are 3 self-report scales which take about 5 minutes to complete each, which are designed to identify areas of strength or vulnerability, and the scales can be administered as an individual or group, and as I said, they can be used independently or together. So the 3 scales, I'll just go through the 3 scales now. So the first one is the sense of mastery. This scale has 20 items and it's a self-report questionnaire, and it consists of 3 conceptually related content areas. The first is optimism, about life and one's own competence, positive attitudes about the world, about life in general, and about their own life currently and also in the future. Self-efficiency, someone's approach to obstacles or problems and ability to develop problem solving strategies. Adaptability, their flexibility, being personally receptive to criticism and learning from their mistakes. The next is sense of relatedness. So this includes trust, support and comfort and tolerance. This has 24 items, again is a self-report questionnaire. So trust is when it looks at when others are perceived as reliable and accepting, and the degree to which an individual can be authentic in their relationships. Support, this is an individual's belief that there are others who he or she can turn to when dealing with problems. Comfort with others, which may buffer stresses in an individual's life. Tolerance, the individual's belief that he or she can safely express difference within a relationship. And then we have the final one is emotional reactivity. So this has 20 items, a self-report questionnaire, and there are 3 areas related to this. Sensitivity, this is someone's threshold for reaction and the intensity of the reaction. Recovery, the ability to bounce back from emotional arousal or disturbance of the emotional equilibrium. Impairment, the degree to which the adolescent is able to maintain an emotional equilibrium when aroused. And yeah, so you get the scores for each of those areas, and as I said, you can use them independently or together. Okay, so next we have the Novarco Anger Scale and Provocation Inventory. This helps clinicians and researchers evaluate the role of anger in various psychological and physical conditions. It is a brief and easy to administer self-report questionnaire which will help to assess anger in clinical, community and correctional settings. The NASPI is composed of 2 parts, the Novarco Anger Scale, which has 60 items, and this tells you about how an individual experiences anger. The Provocation Inventory, which has 25 items, and this indicates the kind of situations that induce anger in particular individuals. The entire questionnaire can be completed in just 25 minutes, and it produces scores for the following areas. So we have a Novarco Anger Scale total, cognitive, arousal, behaviour, anger regulation, and provocation inventory total. In addition, there is a validity index which helps identify consistent responding, whether intentional or inadvertent. And the test has been shown to have good retest reliability in non-clinical, clinical and correctional samples. Next, we have the aggression questionnaire. This is used to screen children or adults for aggressive tendencies. With this routine it's a self-report inventory. It measures an individual's aggressive responses and his or her ability to channel those responses in a safe, constructive manner. The self-report consists of 34 items on which individuals rate themselves on a 5-point scale ranging from not at all like me to completely like me. These include physical aggression, hostility, verbal aggression, indirect aggression, and anger. And then moving on to our autism assessments, we have the ASRS. This is the Autism Spectrum Rating Scale, and they are a valid, reliable, and carefully crafted tool designed to effectively identify symptoms, behaviours, and associated features of the full range of autism spectrum disorders, or ASDs, in children and adolescents aged 2 to 18 years. So the authors of this assessment are the highly respected Sam Goldstein and Jack Naglieri, and it's a US standardised norm reference tool of the autism spectrum, including Asperger's disorder and autism. The ASRS is brief and easy to administer, taking approximately 20 minutes or just 5 minutes for the short form, and it can help to guide diagnostic decisions, treatment planning, ongoing monitoring of response to intervention, and programme evaluation. Using a 5-point Likert rating scale, parents and teachers evaluate how often they observe specific behaviours in areas such as socialisation, communication, unusual behaviours, behavioural rigidity, sensory sensitivity, and self-regulation. We also have the CARS-2. This is the Childhood Autism Rating Scale on the 2nd edition. It's extremely useful in identifying symptoms in autism, and it's an untimed assessment that can be used with individuals aged 2 and older. In particular, it excels in responsiveness to individuals on the high functioning end of the autism spectrum. Those with average or higher IQ scores, better verbal skills, and more subtle social and behavioural deficits. Covering the entire autism spectrum, the CARS-2 distinguishes between mild to moderate from severe autism and discriminates from other cognitive deficits. The complete kit includes standard and high functioning forms, a parent caregiver questionnaire, and guidelines linking scores to interventions. And I'll just list some of the functional areas that are covered within this assessment. Relating to people imitation, social emotional understanding, emotional response, emotional expression and regulation of emotions, body use, object use in play, adaptation to change, visual response, listening response, taste, smell and touch response to and use, fear or nervousness, fear or anxiety, verbal communication and non-verbal communication, activity level, thinking, cognitive integration skills, level and consistency of intellectual response, and general expressions. And then we have the ADIR, which is the Autism Diagnostic Interview Revised. This is a thorough assessment a thorough assessment interview, which can be used with children and adults with an age of above 2 years. It's comprised of 93 items and is highly useful in the formal diagnosis of individuals suspected of having ASD. It can also aid in treatment and intervention and educational planning. The ADIR focuses on 3 functional domains: language and communication, reciprocal social interactions, restricted, repetitive and stereotyped behaviours and interests. And the interview questions cover 8 content areas. So it looks at the background, including family, education, previous diagnoses and medications, their overview of behaviour, their early development and developmental milestones, language acquisition and loss of language or other skills, current functioning in regard to language and communication, social development and play, interests and behaviours, and clinically relevant behaviours such as aggression, self-injury and possible epileptic features. Also available with the ADIR is the DVD training package. This includes a training programme on the DVD, a guidebook with behaviour coding instructions and examples, interview booklets and comprehensive algorithm forms, and an unlimited use scoring CD that allows you to score all algorithm scoring functions of the ADIR. Okay, so hopefully you found the overview of those assessments useful. I just wanted to take a moment to explain Q Global in a little bit more detail. As you probably noticed, I mentioned this a few times on some of the assessments where it's available for Q Global digital scoring or administration. So Q Global is Pearson's web-based system for administering and scoring assessments online. From any device connected to the internet, it allows you to deliver on-screen administration and remote on-screen administration for certain assessments, and therefore you don't require face-to-face interaction between clinician and client in some cases. You have 24/7 secure web-based access. It's portable, as you can enter the data manually into Q Global via any web-enabled device. It generates scores for you, so you can, on some assessments, you can have either a profile report or an interpretive report. It produces accurate, comprehensive reports, plus additional analysis that sometimes isn't available by hand. The reports can be downloaded instantly and can be copied and edited in your own report, so you can edit and change them and save them wherever you like. And it provides abbreviated manuals on the platform through the resource library, and we've also now added various manuals to the platform to purchase as well. For more information regarding telepractice or telehealth, please visit our website for guidance, or feel free to ask me any questions about telepractice or Q Global. Okay, great. So I think we've got some time for questions now. Whilst I'm just looking at the question box, I'm just going to put my contact details on the screen for you, so you can make a note of those. If you have any questions, you can phone, email, or I've also put my LinkedIn account on there, where I often post various things that could be relevant for you. So I'm just going to have a look. That's the questions. I'll just wait a few more minutes in case there's any questions that come in. So one of the questions are most mental health assessments available digitally to use via telepractice? So yeah, so we have quite a few of them. If I go through quickly, I can tell you which ones which are available via telepractice and via Q Global. So we've got the Beck Youth Inventory. So this one is available for on-screen or remote on-screen administration, so that would be fine for telepractice. The same for the Beck range of assessments as well, apart from the fast screen version. The SSIS SEL would be the same. That can be used on screen or remote. And the brown is the online administration. And so is the BASC 3. You can do that remotely as well. So yeah, all of those will be available for you via telepractice. Any other questions? Okay, so it doesn't look like there's any more questions coming in. So we'll end the session for today. Just wanted to say thank you for attending the webinar today, and yeah, look forward to speaking to you all soon. Thank you.